People who struggle with chronic pain and opioid addiction often struggle to find places for treatment, and pain clinics aren't equipped to handle addictions, and addiction center personnel aren't trained to treat pain.
A CU Denver professor may have a solution, though. Denver 7's Lance Hernandez talked to that researcher and to a former addict.
I was sticking needles into my body multiple times per day.
Blair Hubbard became addicted to pain medication after having her wisdom teeth pulled. It escalated to heroin. She lost a finger because of it.
The fourth or fifth day of ever using a needle, I hit an artery in my hand, and it resulted in the loss of blood flow to the end of my finger.
6 years of shooting up her arms, then her legs, led to chronic pain.
I'm very passionate about improving treatment for patients that are struggling with this comorbid pain and opioid addiction.
Dr. Amy Wachholz, an assistant professor at the University of Colorado, Denver, is launching a new study to simultaneously treat chronic pain and opioid addiction. She says treating them separately hasn't been very successful.
Our goal is that we teach patients not only psychological mechanisms to help improve how they deal with the pain and the opioid addiction, but we're actually teaching them techniques that change how their body responds when they experience a pain trigger.
The tests include placing electrodes on the forehead and fingers to measure general and specific stress, and to measure blood temperature at your fingertip.
Then there's an area of your brain that almost acts like a volume button.
Wachholz says patients will learn how to relieve stress before it leads to a pain flare.
So we're giving control over their pain back to the patient.
I strongly support it.
Hubbard, who kicked her addiction 7 years ago, is now counseling others who are going through what she did.
I believe there's something to be said about being able to treat one's addiction and pain at the same time. It's not this long, drawn-out process.
Lance Hernandez, Denver 7.
And that lab right now is looking for men and women 18 to 65 years old for 12 weeks of no-cost group therapy sessions and specialized appointments to research some new techniques designed to reduce substance abuse and pain. So if you'd like to take part in the study, maybe know somebody who does, we have a link for you on our website, and you can